Hi, this is Senator Justin Reedy coming to you live from Annapolis at the end of the sixth week of the 2023 General Assembly session. We are reaching close to the halfway point of the session. And what I try to do with these videos is sometimes I like to talk about maybe a big issue. Other times I want to try to give you a sense of what I'm doing each week and get down in maybe some more details. And I thought this week I'd talk a little bit about what we've been doing in the Senate Finance Committee because, I'm looking at what I see as the big issues around the state, whether it's cost of living or crime, which is a huge issue, and also other items that are of importance like tax policy, the state budget. I'm looking at how we can protect our parents' rights and our children and support reforming our education system in places particularly where it's really failing. So those are all big issues. But in the Senate Finance Committee this week, we spent a lot of time on some interesting items I thought I'd share with you. Apparently, to some of my colleagues, it was important to give the ability for illegal immigrants to be able to access state-funded health insurance plans through our state exchange. If you're a low-income resident of Maryland, you can run through the Maryland State Healthcare Exchange to find out your eligibility and whether there are subsidies and tax credits and things for you to be able to get affordable health insurance. And that's not all bad. We want to have people have the opportunity to have affordable health insurance. Um, and get regular care so they don't show up at the emergency room, and we want people to have a good quality of life. But this is trying to open up state-funded insurance plans that taxpayers basically either subsidize or completely pay for to people who are here illegally. Of course, I'm opposed to that. But it's just interesting. That's one of that's a big focus of some down here in Annapolis, and we had dozens of witnesses come to tell us why we should do that. We also had a number of union and collective bargaining related bills this week in the Finance Committee. We get all the labor and business regulation and policy in our committee. Some of the most interesting ones I found was we had a bill to unionize the grad assistants and teaching assistants at the University of Maryland system. And I got to tell you, first of all, grad assistants, they're not employees. So they're there to study. They get a stipend, and they have the ability to get a reduced, in many cases, reduced college tuition. And these folks, the way that the people were testifying about their conditions and working conditions, you would have thought that they were, shoveling coal into out of the mountain. And it was amazing to me that they're required to work 20 hours a week. Any other work they do has to be on their doctorate. So they literally are here, but they want to have the unions that have a powerful hold here in Annapolis want them to be able to unionize, which would be obviously a huge cost driver to the university system and doesn't make a whole lot of sense. But also, not to be left out, unions came in to support legislation to allow for a bunch of the supervisors at the University of Maryland system to also unionize. And I thought to myself, that's one of the first times I've heard of management also being able to unionize. So we'll see what happens with both of those bills. I don't think either one of them are particularly good policy. We also had a library unionization bill as well, which I take a dim view of. I'm not against the ability to have unions for in the private sector, and I think in some cases in public sector, having a union is not inappropriate. I'm against people having to join a union. I'm against. I think people should have a right to join or not join professional organizations as they see fit. However, I think we're going a little bit too far with some of this stuff. I'm assuming you agree. We also had a bill to ban flavored tobacco, all kinds of flavored tobacco, which is funny because we've now legalized marijuana and all kinds of flavored edibles and all kinds of flavored things you can smoke, but we want to ban flavored tobacco. I'm not a smoker. I don't suggest you smoke or vape, but the idea of banning vape, for example, that actually helps people quit smoking, which is worse for you, doesn't make any sense. But yet the same people that wanted to legalize marijuana and a lot of other things fully with no restrictions, they also want to ban, flavored tobaccos. Doesn't make a whole lot of sense to me. In closing, though, I do want to talk on one positive thing. This is one area we're really working together, and we are working in a bipartisan way on this issue. We know that one of the biggest things that people contact my office about is when they need help with a friend or family member has a mental health crisis or concern, and trying to help people get access to mental health care and what's sort of called behavioral health. It's a problem for children, for adults, for seniors. They're a huge issue, and we know coming out of the overreaction to the pandemic and the way that a lot of policies were did not take into account how bad it was going to be on people's, not just their physical health, but their mental health, to be shut down and to be isolated. Kids wearing masks way past, not even just doing it, but then way past the time that COVID was really a major, death concern. We're working together on a package of policies to try to really get a better handle on how our current system of mental health works and make sure that people have access to it when they go to their primary care doctor, when they have a need early. There's more access to mental health care, to those kind of services. So there's a number of things that Republicans and Democrats, we're working together on, and we don't agree on every issue, but we want to try to find good common ground to really provide resources and access for people with mental health needs. And so that's a positive thing we're working on. As you can see, a lot happening. I look forward to talking to you next week, and I really appreciate the opportunity to serve you in Annapolis, and will do my best to keep you updated. Have a great weekend.